Question 1. A patient is diagnosed with essential hypertension. According to the ICD-10-CM guidelines, how is this condition typically coded? A. Code for secondary hypertension only. B. Code for benign hypertension. C. Code for malignant hypertension. D. Code from category I-10. Answer: D. Code from category I-10. This question tests your knowledge of coding essential hypertension. The keyword essential hypertension is a specific type of high blood pressure. In ICD-10-CM, essential, primary, hypertension is assigned to codes within category I-10. It's important to differentiate this from secondary hypertension, which is caused by another condition, or historical terms like benign or malignant hypertension, which are not used in ICD-10-CM for essential hypertension unless specified as such. Always look up hypertension in the alphabetic index first. It will direct you to the correct category. Remember, I-10 is your go-to for uncomplicated essential hypertension. Question 2. A patient is seen for follow-up after completing treatment for breast cancer 8 months ago. Imaging shows no evidence of recurrence. What is the primary diagnosis code for this encounter? A. Code for active breast cancer. B. Code for a personal history of breast cancer. C. Code for screening for malignant neoplasm of breast. D. Code for chemotherapy follow-up. Answer: B. Code for a personal history of breast cancer. This scenario focuses on coding a patient's status after successful treatment for a past condition. The key phrase is after completing treatment and no evidence of recurrence, indicating the cancer is no longer active. In ICD-10-CM, when a malignancy has been excised, treated, and is no longer present, and there is no further treatment directed to the site, you code a personal history of the malignancy using a Z code. A personal history code indicates that the patient has had the condition in the past but is currently free of it and not receiving treatment for it. This is crucial for tracking patient history without implying active disease. Question 3. According to the ICD-10-CM official guidelines, what is the purpose of the excludes one note? A. Indicates that codes excluded are not included here and the condition is coded elsewhere. B. Indicates that the excluded code should be used only if a definitive diagnosis is not available. C. Indicates that the code excluded should never be used at the same time as the code above the note. D. Indicates that the two conditions are related and should typically be coded together. Answer: C. Indicates that the code excluded should never be used at the same time as the code above the note. This question asks about the meaning of an excludes one note in the ICD-10-CM tabular list. The excludes one note signifies mutual exclusivity. The two conditions listed cannot occur together in the same patient at the same time. For example, if a code has an excludes one note for a specific symptom, you would code either the condition or the symptom, but not both if the symptom is an integral part of the condition. Think of excludes one as meaning not here or never code these two together. Question 4. A patient presents with symptoms of cough, fever, and shortness of breath. The physician diagnoses the patient with acute bronchitis. What is the correct coding approach? A. Code for cough, fever, and shortness of breath individually. B. Code only for acute bronchitis. C. Code for acute bronchitis and any chronic conditions the patient may have. D. Code for acute bronchitis and the symptom codes. Answer: B. Code only for acute bronchitis. This question tests the guideline regarding coding symptoms versus a confirmed diagnosis. The presence of a definitive diagnosis, acute bronchitis, means you should code the diagnosis rather than the individual symptoms, cough, fever, shortness of breath, that are part of the typical presentation of that condition. Symptoms integral to a diagnosed condition are generally not coded separately. The bronchitis diagnosis essentially explains all the listed symptoms. Question 5. A patient is admitted with severe sepsis due to methicillin-resistant Staphylococcus aureus, MRSA. What coding sequence is required according to ICD-10-CM guidelines? A. Code for sepsis, followed by the code for MRSA infection. B. Code for MRSA infection, followed by the code for sepsis. C. Code only for severe sepsis, as MRSA is understood to be the cause. D. Code for the underlying condition causing the MRSA, followed by sepsis. Answer: A. Code for sepsis, followed by the code for MRSA infection. This question requires knowledge of coding sepsis and infectious agents. When sepsis is due to a specific organism, you must code the sepsis first, followed by a code to identify the infectious agent. The guideline for coding sepsis specifies that a code from subcategory R65.2, severe sepsis, must be used, and this code requires an additional code to identify the infectious agent. Therefore, you code the severe sepsis first, and then code the MRSA infection. Question 6. Which character in an ICD-10-CM code is used as a placeholder when a code requires a seventh character but has less than 6 characters? A. 0. B. Z. C. X. D. 9. Answer: C. X. This question asks about the use of a specific character in ICD-10-CM code structure. The placeholder character X is used to fill empty character positions when a code needs a seventh character but is only 4 or 5 characters long. It ensures that the seventh character is correctly positioned. For instance, if a 5-character code requires a seventh character, you would use an X in the 6th position. This ensures the code structure is maintained for accurate reporting. Question 7. A patient sustains a non-displaced spiral fracture of the shaft of the right tibia from a fall while hiking. This is the initial encounter for this injury. What is the correct seventh character for the fracture code? A. B. D. C. P. D. S. Answer: A. This question tests the application of seventh characters for injury coding, specifically fractures. For fracture codes in ICD-10-CM, the seventh character indicates the episode of care. Since this is the initial encounter for the fracture, the correct seventh character is A, which stands for initial encounter for closed fracture. Subsequent encounters or complications would use different seventh characters. Always check the seventh character definitions carefully in the tabular list for injury codes. Question 8. A patient is diagnosed with type 2 diabetes mellitus with diabetic nephropathy. How should these conditions be coded? A. Code for type 2 diabetes only. B. Code for diabetic nephropathy only. C. Code for type 2 diabetes with a separate code for nephropathy. D. Code using a combination code that includes both type 2 diabetes and nephropathy. Answer: D. Code using a combination code that includes both type 2 diabetes and nephropathy. This question addresses coding conditions that have a specific relationship, like diabetes and its complications. ICD-10-CM often provides combination codes for conditions that commonly occur together, especially chronic conditions like diabetes and its associated organ involvement. The guideline for diabetes coding specifies that codes from category E08 E13 include the type of diabetes, the body system affected, and complications. Therefore, you should look for a single combination code that captures both the type 2 diabetes and the nephropathy. Question 9. When coding neoplasms, what determines whether the code should be for a primary malignancy, secondary malignancy, carcinoma in situ, benign neoplasm, or uncertain/unknown behavior? A. The size of the tumor. B. The patient's age and gender. C. The histological type of the neoplasm and its behavior as documented in the pathology report. D. The treatment administered. Answer: C. The histological type of the neoplasm and its behavior as documented in the pathology report. This question focuses on the principles of neoplasm coding. The behavior of a neoplasm, whether it's malignant, primary or secondary, in situ, benign, or of uncertain behavior, is determined by the pathology report. The coder must rely on the physician's documentation and the pathology findings to assign the correct code reflecting the neoplasm's nature. The alphabetic index will often guide you based on the anatomical site and the documented behavior. Question 10. According to the ICD-10-CM guidelines, when is it appropriate to code a sign or symptom? A. Only when a definitive diagnosis has been established. B. When a definitive diagnosis has not been established by the provider. C. When the sign or symptom is an integral part of a diagnosed condition. D. Never, always code a disease. Answer: B. When a definitive diagnosis has not been established by the provider. This question tests your understanding of when to use codes from Chapter 18, Symptoms, Signs, and Abnormal Clinical and Laboratory Findings, not elsewhere classified. These codes are appropriate when the physician has not yet reached a definitive diagnosis. If a specific diagnosis is made that explains the symptom, you would code the diagnosis instead. Coding signs and symptoms is useful for reporting when a final diagnosis isn't known or when symptoms are investigated without a final diagnosis. Question 11. A patient is being seen for a screening colonoscopy. The results were normal. What is the primary diagnosis code? A. Code for a history of colon polyps. B. Code for signs and symptoms prompting the screening. C. Code for screening for malignant neoplasm of the colon. D. Code for routine general medical examination. Answer: C. Code for screening for malignant neoplasm of the colon. This scenario describes a preventative service. The keyword screening colonoscopy indicates the purpose of the encounter is screening for a specific condition, colon cancer. ICD-10-CM provides specific Z codes for encounters for screening examinations. Even though the results were normal, the reason for the encounter was screening, making the screening code the primary diagnosis. Screening codes are used when the patient is being tested for a condition without symptoms, to detect early disease. Question 12. A patient is documented with acute on chronic systolic heart failure. How should this be coded? A. Code separately for acute heart failure and chronic heart failure. B. Code only for chronic systolic heart failure. C. Code using a combination code for acute on chronic systolic heart failure. D. Code only for acute heart failure. Answer: C. Code using a combination code for acute on chronic systolic heart failure. This question deals with coding conditions described as acute on chronic. When a condition is described as both acute and chronic, an ICD-10-CM provides a combination code for the acute on chronic presentation. That single combination code should be used. You would not code the acute and chronic conditions separately. Look for the specific code that combines both the acute and chronic aspects of the heart failure. Question 13. A patient is diagnosed with a fracture of the left radius due to a fall from a ladder at home. The fall occurred 1 week ago. This is the initial encounter. What additional code is required to provide more context about the injury? A. A code for the location where the fall occurred, example home. B. A code for the activity the patient was doing when the fall occurred, example climbing a ladder. C. A code for the external cause of the injury, fall from ladder. D. No additional code is required. Answer: C. A code for the external cause of the injury, fall from ladder. This question highlights the importance of external cause codes, V, W, X, Y codes, in injury coding. For injuries like fractures, an external cause code is required to describe the circumstances surrounding the injury, how it happened, the external cause, the intent, the place of occurrence, and the activity. In this case, coding the fall from a ladder provides crucial information about the mechanism of injury. This information is vital for injury prevention and research. Question 14. A patient is admitted with pneumonia and develops acute respiratory failure during the hospital stay. According to the sequencing guidelines, which condition should be coded first? A. The pneumonia. B. The acute respiratory failure. C. Depends on which condition the physician states is primary. D. Either can be coded first, it does not matter. Answer: B. The acute respiratory failure. This question tests your knowledge of sequencing codes when one condition complicates another. When acute respiratory failure occurs due to another condition, the respiratory failure is typically coded as the principal diagnosis or sequenced before the underlying condition, unless the official guidelines state otherwise or the physician specifically documents a different primary reason for admission. Acute respiratory failure is a severe, life-threatening condition that often requires immediate attention and drives the intensity of care. Question 15. What is the primary function of the alphabetic index in ICD-10-CM? A. To provide the complete code and all applicable subterms. B. To provide a list of codes in numerical order. C. To locate the main term and lead the coder to the appropriate code range in the tabular list. D. To provide definitions for medical terms. Answer: C. To locate the main term and lead the coder to the appropriate code range in the tabular list. This question is about the fundamental use of the ICD-10-CM codebook. The alphabetic index is your starting point. You look up the main term, usually the condition, disease, or injury, in the index. The index then directs you to a specific code or range of codes in the tabular list. You must always consult the tabular list to verify the code and check for any applicable notes or additional characters. The index is a guide, but the tabular list provides the complete and final code information. Question 16. When coding a condition, what is the significance of the instruction "use additional code" in the tabular list? A. It means the condition is excluded and should be coded elsewhere. B. It indicates that another code is mandatory to fully describe the condition or its cause. C. It suggests that an external cause code is required. D. It is an optional instruction and can be ignored. Answer: B. It indicates that another code is mandatory to fully describe the condition or its cause. This question focuses on the meaning of a specific instructional note in the tabular list. The use additional code note signifies that the code cannot stand alone and requires a secondary code to provide more detail. This is often seen when coding underlying conditions that manifest in a particular way, or to identify infectious agents. For example, a code for a disease might have a use additional code note to identify the specific bacteria causing it. Following this note ensures complete and accurate coding. Question 17. A patient presents for routine follow-up after a kidney transplant. The transplanted kidney is functioning normally. What Z code is appropriate for this encounter? A. Z09, follow-up examination after treatment for conditions other than malignant neoplasm. B. Z48.2, encounter for aftercare following organ transplant. C. Z51.89, encounter for other specified aftercare. D. Z94.0, kidney transplant status. Answer: D. Z94.0, kidney transplant status. This question tests your ability to select the correct Z code for specific aftercare or status conditions. While Z09 and Z48.2 might seem plausible, the most specific and appropriate code for a patient who has an organ transplant and is being seen for routine follow-up related to the transplant itself is a transplant status code from category Z94. This code indicates that the patient has a transplanted organ. Always aim for the most specific code that accurately reflects the patient's status and the reason for the encounter. Question 18. What is the main purpose of the ICD-10-CM official guidelines for coding and reporting? A. To provide the numerical codes for diagnoses. B. To provide definitions for all medical conditions. C. To provide rules and instructions for using the alphabetic index and tabular list correctly. D. To list all reportable procedures. Answer: C. To provide rules and instructions for using the alphabetic index and tabular list correctly. This question is about the foundational document for ICD-10-CM coding. The official guidelines are the authoritative source for applying the codes found in the alphabetic index and tabular list. They provide crucial instructions on sequencing, combination codes, notes, and chapter-specific guidelines, ensuring codes are applied consistently and correctly. Mastering the guidelines is essential for accurate coding. Think of them as the rulebook for using the code set. Question 19. A patient is diagnosed with otitis media, unspecified. Which level of detail does unspecified provide in the code? A. Very specific, detailing the exact type and location. B. Moderate, indicating the general condition but not the specific type or cause. C. Lacking detail, meaning the documentation did not provide enough information to code to a more specific level. D. It indicates the condition is congenital. Answer: C. Lacking detail, meaning the documentation did not provide enough information to code to a more specific level. This question addresses the meaning of unspecified codes. An unspecified code is used when the medical record documentation does not provide enough specific information to assign a more detailed code. While it indicates the general condition, otitis media, it lacks crucial details about the specific type, example acute, chronic, serous, suppurative, or location if applicable. Coders should strive for the highest level of specificity documented, but use unspecified codes when that detail is unavailable. Question 20. A patient is seen in the emergency department with abdominal pain. After evaluation, the diagnosis is gastritis. How should the abdominal pain be coded? A. Code abdominal pain as the primary diagnosis. B. Code both abdominal pain and gastritis. C. Code only gastritis. D. Code abdominal pain as a secondary diagnosis. Answer: C. Code only gastritis. Similar to the earlier question about symptoms, this scenario involves a symptom leading to a definitive diagnosis. Since the physician diagnosed gastritis as the cause of the abdominal pain, you would code only the gastritis. The abdominal pain is considered a symptom integral to the diagnosed condition. Coding the symptoms separately after the definitive diagnosis is made is generally not appropriate according to coding guidelines. Question 21. When coding an adverse effect of a drug, what is the correct coding sequence? A. Code the drug first, followed by the nature of the adverse effect. B. Code the nature of the adverse effect first, followed by the code for the drug causing the adverse effect. C. Code only the adverse effect, as the drug is implied. D. Code the underlying condition being treated by the drug. Answer: B. Code the nature of the adverse effect first, followed by the code for the drug causing the adverse effect. This question tests the specific guidelines for coding adverse effects of medications. An adverse effect is a reaction to a drug used correctly. The guideline requires coding the nature of the adverse effect, example rash, nausea, first, followed by a code from Chapter 20, external causes of morbidity, to identify the drug. This sequence highlights the patient's reaction while also identifying the substance involved. Always consult the table of drugs and chemicals for the correct external cause code. Question 22. A patient has documentation of both history of resolved MRSA infection and MRSA colonization. Which condition should be coded? A. Only the history of resolved MRSA. B. Only the MRSA colonization. C. Code both history of resolved MRSA and MRSA colonization. D. Neither should be coded as they are not active infections. Answer: B. Only the MRSA colonization. This question distinguishes between a past infection and the presence of the organism without active infection. While the patient had a past, resolved MRSA infection, which would be coded with a history code if relevant to the encounter, the documentation also indicates current MRSA colonization. Colonization means the bacteria is present but not causing an active infection. There are specific codes for MRSA colonization, and this represents the current status, which should be coded. A history code would only be appropriate if the resolved infection was pertinent to the current encounter. Question 23. A patient presents for a follow-up visit after hip replacement surgery due to osteoarthritis. The purpose of the visit is routine post-operative care. What is the primary diagnosis code? A. Code for osteoarthritis of the hip. B. Code for the status of the hip replacement, example Z96.64. C. Code for follow-up care after surgery, example Z09. D. Code for pain in the hip. Answer: B. Code for the status of the hip replacement, example Z96.64. This scenario involves coding for a patient with a medical device after surgery. The key is that the patient has a hip replacement. ICD-10-CM provides Z codes to indicate the presence of artificial joints or other prosthetic devices. When a patient is seen for routine follow-up related to the presence of such a device, the appropriate Z code indicating the status, example artificial hip joint, is typically the primary diagnosis. This code tells the story that the patient has a prosthetic and is being managed for that status. Question 24. According to ICD-10-CM guidelines, what is the difference between an excludes one note and an excludes two note? A. Excludes one means not coded here, while excludes two means not included here. B. Excludes one means the conditions cannot occur together, while excludes two means the conditions are not included but a patient could have both simultaneously. C. Excludes one applies only to congenital conditions, while excludes two applies to all other conditions. D. There is no significant difference, they are interchangeable. Answer: B. Excludes one means the conditions cannot occur together, while excludes two means the conditions are not included but a patient could have both simultaneously. This question directly asks you to differentiate between two important instructional notes. The critical distinction is that an excludes one note indicates mutual exclusivity, you can't code both conditions together. An excludes two note, on the other hand, means that the condition listed is not included in the code above the note, but the patient could have both conditions at the same time, and if so, both would be coded. Understanding this difference is vital for accurate code selection when multiple conditions are present. Question 25. When a patient has a chronic condition that has no specific code, and the documentation describes symptoms associated with that condition, how should you code? A. Code the chronic condition as unspecified. B. Code the signs and symptoms only. C. Code the chronic condition using a general code for the body system affected and also code the symptoms. D. Code only if the physician specifies a definitive diagnosis. Answer B. Code the signs and symptoms only. This scenario addresses coding when a definitive diagnosis for a chronic condition isn't available at a level of specificity that allows for a specific code, and only symptoms are documented as associated with it. If the documentation does not support a specific or even unspecified diagnosis code for the chronic condition itself, but only describes the symptoms, you should code the documented signs and symptoms. Remember, code what is documented. If only symptoms are confirmed and linked to an unspecifiable chronic issue, the symptoms are the most accurate reflection of the documented condition for coding purposes.